Hi, and welcome back to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this is exercise number 3 in the tennis elbow exercise program number 2. So this exercise is called supination and pronation. If you did the exercise program number 1, then you're familiar with this, and we're just adding some resistance. But this exercise, if you remember, is just turning your palm up and turning the palm down. So you can assume that position that we've done for most of these exercises already. You can also just hold your arm out away from your body without any support, right? So it looks like this. So it's supination and pronation, turning the palm up and turning the palm down. Remember, when you do this exercise, don't let it just drop. Okay, that's going to be irritating on the wrist and the hand and the elbow. So make sure you do that with good control. The longer you do this, the more tiring it is going to get, I promise you. Again, you can just do that with support to that forearm as well. But always do that nice and controlled. I want to show you another way you can do this exercise with a trusty hammer. Generally, I tell my patients when they do this exercise at home to use a hammer. This is just my favorite way to do the exercise, simply because of the hammer and the hammer head. It gives you some good resistance. So when you start with this one, I want you to hold onto the hammer in the center of the hammer, or in the middle. And it's the same exercise, so turning the palm up, turning the palm down, doing it nice and controlled. You don't let it drop, but nice and controlled. You can do that with support or with your arm just out to the side. No support. All right. Now you can also do that with a can of beans. And then I just want to show you that exercise with the TheraBand. So with the TheraBand, for turning your palm up, right, you need to have that band across the palm of your hand. Now when you do a TheraBand, you're going to have to break these two exercises up. You can't do them at the same time because of where that band needs to be placed on your hand. So for supination, turning the palm up, that's what that looks like. The band is on the inside of my palm. Oops. For pronation, that band needs to be coming along the back side of your hand. You're going to grab onto it with your fingers and then just turning that palm down like that. Right? So it can be done with the TheraBand. It's just you have to break those two exercises up simply because of that TheraBand. So when you do this exercise along with all the other ones in this program, I want you to do 3 sets of 15 repetitions. You can take a 10 to 20 second rest in between each set, and I want you to do those once a day. Remember, I still want you to shoot for every day of the week to get these done for right now. You're committing to 4 to 6 weeks for me for this program. And if you find that you're still having some pain and swelling that comes off and on, especially depending on what you've done in a particular day, then don't forget about ice. Put some ice on that elbow. It can still be useful at this point.